Welcome back to WBRZ News 2 at 4. Dr. Z is here with us today, and we're talking about a relaxant treatment for your neck. Talk to us about the neck. Well, what happens?
Well, we age. And if we don't do anything to help protect your neck, then we age faster. And I'm seeing a lot of young women who are 10 years older. Their neck tells me they're 10 years older than their age, and it's because of the sun exposure they've had and the tanning bed. So I'll always go back to my ABCs on the basic daily protection. So your sunscreen, nothing, I don't care whose name is on the label, how much it costs, gold-plated or not. Nothing will do more for your neck than sunscreen. So that's number one. And then we do have some before and after pictures because a relaxant like Botox, Xeomin, Dysport will, and I don't know if that's our camera, but it looks a little bit out of focus, but see the bands on the left?
Right.
Those are called your platysmal bands. It's from a muscle, a large band of muscle that helps with expression. We don't need expression on our neck. And it pulls the neck skin over time, and it causes the laxity, one of the reasons that you have laxity in your neck. And so you can see, and here's another one. On the left is before a relaxant, such as Botox is used, and then on the right is after. And then I think we have one more. Yes, so it's expression. When you grimace, you see how strong that band is? Over time, it's pulling that skin. So this is something that I do for myself and my patients. Some patients, not everyone will benefit from it. I have to see how strong the muscles are, and I'll make you grimace and make that face, and then we'll use a little bit. And it runs about $300 maybe a treatment, and I recommend it 2 to 3 times a year. And that's in addition to some of your other treatments, your sunscreen, the relaxant that you can use. If you have any discoloration, that ages your neck skin too. And you don't want to just concentrate on your face and leave your neck. You know, if there's a lot of laxity in your neck, I'm going to refer you to a plastic surgeon because there's only so much you can do with non-invasive treatments. But seek non-invasive first, and if it's right and if it'll work, do that, because you can always go to surgery later. And I like the natural look the best, and this is one of the ways, if you start early, and it depends on your sun exposure, but some people in their early 30s need to start this, and it may be once a year at that point in time. But I saw a woman who had been doing it for 15 years, and most doctors don't do this. It's a very specialized procedure. Her neck was beautiful.
Really?
She was older than me. Beautiful. Her neck was prettier than mine, too.
So what is your favorite non-invasive treatment?
On the neck?
On the neck.
Sunscreen.
Right, of course.
And then Ulthera. But if you have a strong muscle band, that platysmal muscle band, then a relaxant such as Botox is beautiful also.
And how many treatments? You said 2 to 3 a year, but
yes,
after one?
Just one. That's just with one treatment.
Wow.
Those before and afters.
So
yes,
pretty good results.
Absolutely.
Okay, great. And what did you bring with you here today?
Oh, these are the basics. So your sunscreen.
Okay.
And then something like an antioxidant, vitamin C being the strongest, that will help with the ultraviolet rays that cause free radical damage, that cause aging. And then a tretinoin. We may do that on our face, but we forget to do it on our neck. A very mild form, and maybe 2 to 3 times a week. Our neck skin is thinner because you can't use as much. And then some type of moisturizer. Don't forget moisturization on your neck, but it does not count for sunscreen. You have to use the sunscreen first.
Okay, and then we also have a basket to give away. Can't
Yes.
forget about that.
Yes, as always. Here we go.
All right, well, Dr. Z, thank you so much for joining us today.
Sure, thanks for having me, Brittany.
You're watching WBRZ News 2 at 4. We'll be right back.
If you've been in an accident, do what injured people